It's a very, very, very exciting time to be in healthcare. Lots of very revolutionary changes are going to be coming, and I'm going to talk about a little bit about how we got to where we are, the challenges we have, and then going forward from there. I have been in the healthcare IT space for well over 20 years. I try not to date myself that much, but I started out in the infrastructure world before cybersecurity and anything was really even a definition or a word. And as new threats and things were identified, I quickly found myself pivoting, and my journey led me into information security. I was gifted with the opportunity to become the first CISO at the University of Nebraska Medical Center and Nebraska Medicine in 2018, and it has been a wild and crazy journey ever since, but an exciting one and always changing. My mother always asks me, what do I do every day? And I tell her it's something new every day because of all of the great work that everybody is doing around in healthcare. I'm honored to have been asked to present to you today. As again, I said, I'm very passionate about this topic, and I want to make sure that people understand we all have a role in keeping safety at the forefront of all of our healthcare. And my role is digital safety. But it is crucial for protecting sensitive patient data, preventing cyber attacks, and ensuring the integrity of the healthcare system. So healthcare organizations store various types of sensitive information, including your patient health information, but also medical histories, insurance details, and then now we're all tiptoeing into the genetic data. This is an enormous amount of data that we are storing at our sites or in our systems. Without this data, modern clinical care could not happen. Data enables precision medicine, targeted treatments based upon clinical results, and allows for organizations to optimize the healthcare journey for patients. As I tell people, data is the crown jewel of our organization, and it needs to be protected at all costs. But cybersecurity, is crucial for maintaining the integrity of the healthcare services and ensuring patient safety. Healthcare integrity can be lots of different facets, from having trust with clinicians and providers and whatnot. But for the sake of this presentation, we're going to talk about digital integrity. Digital integrity is in healthcare refers to the accuracy, completeness, and consistency of the electronic health data throughout the entire life cycle. It ensures that the patient information is reliable and trustworthy, which then allows the clinicians and the researchers and the informatics people to be able to know that what they're doing based upon that data is complete, accurate, and the right thing to do. I always tell my team that our sole duty is to protect that data for our patients so that our clinicians, researchers, and the educational world can thrive and excel. It helps having a health digital integrity focus it helps us to prevent unauthorized access to medical systems, and it protects the sensitive data from breaches. And it also can help prevent medical errors. Medical errors in the United States are estimated to cost between $17 billion and $29 billion a year. And these are direct, indirect, all sorts of costs, but that's an astounding number. But if we can make sure that that data behind the scenes is accurate and protected, we can help the entire organization make sure that they can continue operating. Cyber attacks can severely disrupt hospital operations. They can lead to delays in treatments, and again, errors in medical procedures, and ransomware attacks in particular can encrypt critical data, forcing hospitals to divert cases and also delaying life-saving procedures. Robust healthcare operations have an extensive business continuity and disaster recovery plans. However, those plans are very limited in the sense that they're meant for a small outage for a little period of time. But no operations unit can plan for an extended downtime that lasts days or even weeks to months. I looked up some stats, and it says in 2024, the average downtime was 16 days due to a ransomware attack. 16 days. Can you imagine how can a hospital operate and treat patients end to end in 16 days? And then the average loss per day of revenue to the organization was about $900,000 per day. And that's just the actual operating expenses. There's way more expenses that happen after the fact. So in 2024, also the average cost of the healthcare data breach ended up end to end with loss of revenue and legal things and other mitigating factors cost approximately $9.77 million per attack. These are big dollars, big money, big risks. So how do we help this? So I'm going to explain to you now the current IT landscape in healthcare and why it matters to think about the holistic picture so that we can understand how cybersecurity and healthcare IT are really embedded in everything that we do. But as healthcare continues to digitize and modernize, cybersecurity has to play a crucial role in ensuring that every system that we advance to, modernize, purchase, plug in, snap into the rest of the ecosystem is safe and secure. With the advancements of EHRs, which I'll explain to you the timeline in a second here, there's been then telemedicine, remote patient monitoring, all of these things that have enabled us to be able to do healthcare in the modern world. It all produces more and more risks to the organization. But healthcare IT, and what we call healthcare IT, that is all of the systems inside of a hospital that allow you to treat patients, monitor patients, document on patients, image patients, all of that. It's one of the fastest growing segments of technology. And the ability for disparate systems to interconnect with each other now that couldn't ever talk to each other before is creating an experience that is creating this end-to-end patient care journey that is going to just exemplify not only the patient care world, but also then the risks that come with all of these interconnections. So in the early 1960s, large healthcare organizations like Mayo were really fortunate that they tried to create their own medical record system. And people would dabble in it all the way up until about 2008. And you say, why? That sounds like a long time. Well, because in 2008 is when the government passed the Meaningful Use Program that was part of the 2009 HITECH Act. And it incentivized and encouraged healthcare organizations and clinicians to adopt the electronic medical record. So really, this explosion in healthcare IT started in about 2009, which that is not very long ago. But this adoption spawned the digital transformation. The electronic health records drastically improved patient data management accessibility, going back to that integrity that we talked about. It opened the doors for telemedicine, remote patient monitoring. Now we can see patients virtually. We don't have to have all the brick and mortar doctor's offices anymore. And it also has gone into the continuous health monitoring. So you might have your pacemakers now are not just going to be read when you go into the doctor's office. You can actually have an app on the phone that your pacemaker connects to that then connects in to the EMR and your doctor can see it real time. And the modernization of medical devices themselves have just created this vast ecosystem that is known as healthcare IT. Over the past 10 years, the biomedical device market has experienced one of the most substantial growths, but due to all the technology advancements and rising health awareness. Innovations such as the health monitoring devices, like I was just talking about, and telemedicine had just created new opportunities for everyone. But regulatory changes have also shaped the market, leading to an increased investment in research and development to ensure that these devices are now safe and secure for our patients. But it's also allowing us to have cutting edge solutions to improve patient care at the drop of a hat. We talk a lot about our imaging systems and we talk a lot about AI in healthcare, but what we don't really realize is that all of these systems, the MRIs and the CAT scans, they all take their images and they put it into a repository. But then we have the ability now, due to all of these advancements, to have the analysis done instantly on all of those images, so we can look at a picture of your lungs, say, and quickly identify areas that look suspicious so that the radiologist doesn't have to look at everything. They can just hone in on the slides and the images that are going to tell them the results. The speed to the reading of even the images today is exponentially faster due to all of this technology that we have running on the systems. This diagram really shows this growth pattern. It's really crazy. And again, this is 2018, which was, again, not very long ago, to what they expect in 2030. More and more devices are going to be used in clinical rooms. And I'm going to talk about that here in a second. But it's just based upon all of the new things that we can do in life. If you think about your home, I always talk about like your television. Back in the day, you didn't have a remote. You actually went up to the TV and turned a dial. Then they started to have a remote that was wired to the TV. Then it went onto a wireless remote. Then came cable and all these channels. And then now look at the TVs today. We don't even have to have a cable service. We can have on-demand anything. So think about that in healthcare. Think about that in a ICU room. Think about all of the things that we now can have that are monitoring the patients and reporting back in real time. No longer are we forcing the clinicians to go and run from room to room to room to validate vitals. It's automatically sending it back to a centralized console. And at our institution, then, if anything is an abnormal alert, it instantly goes to the phone that the nurse has that's caring for you and instantly calls them so they can come to you. All of this is done through the advancements of healthcare IT, interconnected, and medical devices. And as I said, so medical devices that have connections to your network, they're like the infusion pumps and all of these things, they're advancing and multiplying at a rapid rate. Right now, we're at about every room in the hospital has between 15 and 20 at any given time of devices that could be used, whether it's blood pressure machines, the monitoring system for your telemetry medicine, to infusion pumps that we now have bidirectional infusion pumps that not only will tell us how it's dripping, but we can actually send new instructions to it without actually having to go in there and punch in onto the infusion pumps. It's growing exponentially. The amount of IoT things in a hospital can be twice the number of traditional network devices. So if you think about the computer in the room, that's just the computer in the room. There is way more things around us besides just that computer. But with that becomes a lot of risk. And one of the things that she was talking about when she introduced me is that we had a huge project at work where we had over 9,000 of these connected medical devices that had traditionally not been protected. And I'm going to go into why in a second. But every one of those devices has a minimum of 5 to 7 vulnerabilities on it. Many have way more than that. And because of how expensive these systems are, many hospitals cannot afford to replace and life cycle them out. So we're forced to have legacy devices on our network. But in came the Omnibus Act of 2022. And I remember this very clearly, as prior to this, we would identify these vulnerabilities on these systems. We would go to the vendors, we would go to the biomedical group, and we would say to them, we have these, this MRI machine and the post-processing system that's running it, and it has all these vulnerabilities on it. We need to get this fixed. And their excuse was, those are FDA approved devices. We can't touch them, or we blow away the FDA approval, and that can take years to get. Well, after years and years and years of all of us healthcare CISOs notifying the FDA and putting in complaints and whatnot, the FDA finally came out in 2022 saying, nonsense, biomedical device manufacturers, nonsense. You must provide not only the assurances that all of your systems being built from here on out are safe and secure and can be maintained that way, but you also have to allow us to go back and fix those. Now, I'm going to tell you, this was like dumping the apple cart upside down for these vendors. They had never thought about cybersecurity. They had never thought about any digital safetiness in these devices. Many of these devices weren't even really ever meant to be in a big ecosystem like this connected, because they were just standalone systems. So this provided us an opportunity to fix, but also, I would say, exposed a huge problem in all healthcare organizations. And then, like I said, they're expensive. Millions and millions and millions of dollars are spent every year on medical devices. And if you were to life cycle them out, I mean, one MRI machine can be $5 to $7 million. And if you had to cycle it out every 10 years, that's going to just erode at the margin level. So we have to figure out, how do we handle end of life devices? How can we protect them? How can we bucket them? How can we make sure that they are safe, allowed to function, but don't impose any new risks to the organization? So we're constantly trying to think about how we can do this. So with all of this, there's the ecosystem of what really entails a medical center today. So now, why do we have to care? What are the real threats that are really coming to us in healthcare IT? Well, the one that's always in the news is ransomware. So if you don't know, I'm going to give a little definition of what ransomware is and explain to you how it can happen. So ransomware is a type of malicious software, or they call it malware, and it prevents you from accessing files in your computer, or if you're connected to networks, it can go to the network's drives, and then it basically acts just like you would think in ransomware. Then it would demands money for a key that will unlock your files. They can cause costly disruptions to operations at a healthcare organization, to any organization really, but healthcare, I think, is riskier just because of the whole patient life perspective. But how does it come to be? Well, I can tell you, in 2020, we actually had a ransomware event at our organization. And I like to tell this story about how it came to be, because you'll be shocked at how this could happen. This can happen every day. So it was 2020, September of 2020. COVID hit and really shut down the world and made us go remote work in March. So we're talking September. We had a user who was working from home. And again, if you think about all the protections and everything we had in organizations prior to 2020, really, healthcare was not a remote work type of opportunity. Healthcare was really, you go to campus, we had firewalls, we had all these protections around basically the physical campus. We didn't have them to all of a sudden the 18,000 remote offices that we just all of a sudden inherited when we all went home. So it introduced this whole new risk and this whole new landscape, which also introduced so many more holes into the environment, which is why healthcare attacks have been on the rise since the pandemic. Bad actors recognize this. So anyway, this user was checking her, I think it was her Yahoo or Gmail account before work started that day, and saw that there was an invoice in her inbox, opened it up. It was a PDF, looked like for lawn service. She's like, I don't know who this is. Took it down, deleted it, went on her merry way. Well, what she didn't realize is that just opening that PDF, which seems like a very benign thing that we do every day, opening that PDF actually downloaded malware onto her workstation without her even knowing it. She didn't click on anything. She didn't do anything. It just spawned it. It downloaded onto her workstation, and then once she connected in for the day, that's how it got into our network and then spread. So it can happen that fast. One email, one user, and then it basically took us down. We were down for about 5 days, which back then, I told you 16 days is the average today. In 2020, especially during the pandemic, the average downtime was over 40 days. So the fact that we were up in 5 days was pretty much of a miracle. But I'm just saying, it took everybody down to its knees. However, just even if you think about that, the other main attack for pretty much healthcare and in most industries is phishing attacks. And so what is a phishing attack? So phishing attacks are where you get what appears to be spam email or emails that you don't know who they're from, or people are impersonating people you are. They ask you to click on this link to get a file, or click on this link to go to this website. And then it asks you, oh, enter your username and password to get access to this. Well, many times those sites are fake, and you enter your username and password, and then they try to come, as soon as that is harvested, they come in and try to pretend to be you, try to get into your system with that username and password. Now, I will tell you, with the onsets of a lot of protections, we require multi-factor authentication. Things like that are ways that we can put another deadbolt on that. But they still have your username and password. It's still a potential breach. And depending on how your organization is handled, you might not have multi-factor authentication enabled on everything. And so those things are at risk then from a bad actor getting in, impersonating the person. But there's still other ways. So as we are adopting, you hear cloud technology. You can talk about Google Cloud, AWS, Azure, all of these things. There's a lot of buzzwords out there. But a lot of things in healthcare are moving to what we call cloud computing, because some of those post-processing analysis of the images and all that stuff, it is so expensive to have the compute power in everybody's data center. It's cheaper to subscribe to the high-end analytics and the post-processing services up in, say, AWS or Azure, and let them crunch it and then just send us back the results. So this is becoming an increasingly powerful tool and time saver for our organizations. However, with everything new comes risks. People who are in cloud security are very, 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 very specialized people. And it's not just the same as what you protect if it was on-premise in your data center. It takes a completely different skill set of people. And so the risks of misconfiguration are very, very high. And this is one of the things that we are really working on this year at our organization, is getting our arms around all of our cloud compute and what we're doing to make sure we can deploy it in a safe environment with guardrails around it, because that is the last thing in the world that we need, is any of our patient data being mishandled in a cloud, which we are controlling. Another thing that's really important for the healthcare is, how do our patients get to us? Patients get to us via the websites or mobile apps or things like that. I mean, that is the intake for our users to get in. So those are also under attack, and highly attacked pieces for the organization, and must be protected all around. Not only from a patient's identity perspective, but also from any providers or people like that that are getting into the same systems. Those are often forgotten about, by the way. People install them and then they forget about them. And then another thing that is really becoming prevalent here in the United States is really insider threats. And it's not necessarily insider threats as far as an employee from the inside wants to do malicious harm. It's almost more from an insider privacy threat, where it's okay if I saw an ambulance at my neighbor's house the other day. I wonder what happened to him. So as you're working, you go into the EMR and you look up your neighbor to see what happened to him. All of those are it's malicious, and it has privacy implications and breaches that users don't even think about, because it's not necessarily a cyber threat, but privacy and information security walk arm in arm in a healthcare institution. So we actually consider privacy threats cyber threats as well. And then this one is really coming to light as we get more and more systems, more and more connected devices. We are depending more and more on third-party vendors to help us with that. Like I said before, ever since 2022, vendors are now required to provide us security patches, provide us new updates to their software, provide us all of these tools. So we have to trust them, and trust them that what they're giving us is not going to take the system down and is safe. But we have thousands of these vendors. And so not only are we trying to protect everything that we have to also protect those vendors. And then how do you rate and the vendors. Are they a safe vendor? Are they a risky vendor? Are they a startup vendor, which startup vendors are fine, but do they understand cybersecurity, healthcare IT, and all of the risks around it? Because if they don't, we don't want to take the risk of going with a startup to do this because they're not going to build it from the ground up correctly. So this has spawned an entire branch, I would say, inside of information security teams dedicated. I have a team of about 5 people dedicated to just third-party vendor management and risk management. And then, as we are all connected, we all have our own phones, we all have all of these things, and we don't want to carry around multiple devices or things like that. So how do you allow your workforce members to use their device? We have a tagline at our organization called "Anywhere, from any time, on any device, you can get to us in a safe and secure manner." But that took a lot of architecting and deploying of the proper system to be able to do that. So how do we do that in a safe manner? We had to contain a protected, we call it the protected moat, inside of your phone, where all of our apps are deployed, maintained, secured, updated. And then if you leave the organization, the software that we have on your phone just takes away that moat and doesn't touch anything else on your phone. No photos, no text messages, nothing. We actually can't even see those outside the moat. But those systems are expensive. They're expensive and they're very technical, and they take people to maintain them. Again, most of the healthcare organizations don't have all of these people and workforce members in IT to support all of these things. So all of that can just be very, very risky if you don't have it deployed in the right way. And then we get back into the legacy systems again. I keep saying there's themes you'll see throughout this whole presentation. People cannot afford to replace all the systems inside of healthcare IT all the time. Just like your car. You don't, just because the warranty is up doesn't mean you go get a new car. A lot of people drive their cars all the way till they don't work anymore. That's acceptable at home, but is it acceptable in the organization? So that's why you have to work with leadership to figure out what is acceptable, what isn't, and how do you raise those, the ones that are highly vulnerable, up so that they are addressed. Well, that really brings us into how do we talk about this? How do we bring this up to a level outside of IT technology? We have to have the entire organization on board. Cyber attacks, they can result in downtime, penalties, damage to reputation. So therefore it's crucial to maintaining patient safety, preventing financial losses, and maintaining trust. But unfortunately, in today's environment, many organizations still view cybersecurity as a barrier. Until organizations elevate it as a strategic asset and part of their overall safety strategy, organizations themselves are going to continue to remain vulnerable. And as we've described earlier, healthcare systems are very, very, very complex, and they're increasing in complexity every single day. And so with that, the healthcare systems face challenges, such as, integrating these technologies together, dealing with the outdated software, and then come on the regulatory issues like HIPAA compliance. And it's very difficult to maintain balance of information security and ease of use and patient safety. But HIPAA is really the overarching regulation that drives most of our decisions at my organization. We must comply with this regulation, and it mandates the protection of patient data. And cybersecurity is a critical piece to protecting that patient data. But with the new HIPAA security rule that it was published, for comments up until I think about March 6th, they took it down. The last I checked, it had thousands and thousands of comments on the document. It was about 400 pages long. But there's some clear, distinctive changes that are coming that is going to affect all healthcare IT, not only cybersecurity, but all healthcare IT going forward. In the previous high-tech security rule from about 2008, 2009, it had that you should do these things. We recommend this. It's addressable. You should. Well, it eliminated all of that language. Everything is going to be required. There's going to be no gray area. Another thing that they are requiring is that you have all of your information security and IT policies map directly back to the security rule provisions. So you can say, to meet this rule, we are doing this. It was kind of all loosey-goosey before that. Now they're mandating it. Then they're also mandating technology asset inventories and maps. And what this really means is, if I want to think about my radiology department. So my radiology department is usually set up with a radiology information system, whether it's inside of your EMR system or a standalone one. It has that, so it knows the orders and things of what your basic operations. Then you have all of your MRIs, CAT scans, X-rays, ultrasounds, all of these different systems. Each one of those systems has a way that they send their images back to a repository, usually called a PACS. So it sends all the images back to this big, huge data store. But like we were talking earlier, how do we really analyze and look at those images? Well, we have to get the images onto a post-processing system, many different systems. And not only many different systems, but you can use one that specializes in lung cancer, or another one that specializes in finding breast cancer and things like that. So all of these different things have all these different units. All of these things is part of an asset inventory of a technology realm. The new HIPAA security rule is going to require us to have all of that documented. I can tell you right now that, as I was saying, the explosion of healthcare IT, the explosion of 15 to 20 items in each room that all connect back to a different thing, this is going to take a lot of work. I think it's going to be really good, but it's going to take a lot of work. And then what they're also saying in that new HIPAA security rule is you must comply. The latest I saw was something about maybe 2026, 27, but again, that was really debated in the notes. And so we'll have to wait until the rest of the year here to see what the final rule really is, but it's coming. And so I've been warning and discussing this with leadership at my organization and all of IT, and we've gone through a lot of the proposed rule of what is this going to mean for us? Because it's not just, this isn't technology. This is people in process. People in process that is required to identify the risks to the organization. And then there's penalties for noncompliance, and they're steep. If there is a breach or an event at your organization, the Office of Civil Rights, the OCR, they are the people that enforce HIPAA. They will come and they will audit you, and they will look at how are you complying with those HIPAA privacy and security rules, and what are you doing about it. And penalties for noncompliance are very substantial. And they have a list on their website of, I would say, what in the industry we call it the naughty list. And it lists every single organization that has had a breach of over 500 patients, and 500 patients is not very many. And you're on the wall of shame. And so your reputation can go down from that. And all of this is very expensive, like I said, and $900,000 a day to have your systems down, because you're going, you can't schedule new patients, you can't transfer patients, you can't, procedures can't be done, all of these things. All of these things are things that we have to elevate to the higher levels so they understand why this matters in our organization. Why should we care? And so this is my favorite part. I told you all the doom and gloom. I told you all of the scenarios of how these things happen and why they can happen, but there are ways to fix this. And so we're going to talk about mitigation strategies. And it really, like I said, there's people, process, and technology. Really, the policy and governance is the people and process. Defining and developing real, clear, concise policies that, like I said, go right back to the frameworks of what rule and what you're trying to protect, and then developing the technology that helps you enable that is critical. If you have policies and rules that are loosey-goosey or not clear, nobody's going to be able to follow them. And then really, incident response planning and management is key. You will have an event that happens. It is not a matter of if, it's a matter of when, and it's a matter of when again. That's what I tell all of our organization. We've done so many things to try to tighten and shore up the institution, so we will not have that same type of event, but there's going to be new threats that come out, and there will be another downtime. And so how do we minimize that? How do we get the organization to respond quickly? And how do we have processes in place that allow us to care for our patients if a system is down? That goes into education and training. Regular training for all staff, not just IT, not just technical people, everyone. We have to promote a culture of cybersecurity awareness. It starts with the top down. We actually run every year at my organization. We run last year was about 4 or 5 hour, we call it a retreat, with all of our C-suite and all of their direct reports. So we are talking a very, very expensive meeting if you really think about their salaries going on. But we talk about what are we going to do? How are we because those aren't the people that are fixing the systems. Those are the people that are managing the operations of the organization. And so their business continuity and incident response is completely different than somebody that's trying to restore a system that is down. And you have to do end-to-end training from everybody in your organization from the role that they're in to create this awareness and to be able to survive from the incident when it happens. I really like to put this one up because I want you to think about it from the perspective of the organization that you are at or that you will soon be at. There's what they call 5 stages of cyber maturity. And most organizations are never at a 4 or a 5, I will tell you. Stage 1 is when, whatever, nobody cares. It's irrelevant. It's never going to happen to us. And then stage 2 is like, well, it might, but we're so busy with everything else, we're really not going to do anything about it. And then stage 3, this is where most of the organizations are really falling in. The top leaders get it because of conversations like this that I have with people, and I explain the risks and how it can happen so easily. They understand it, but everybody else in the organization is so busy just caring for patients and doing their jobs every day that they don't think about it and they don't have time for it, right? But really, stage 4 and 5 is where you have to be. And there are ways to get there. We've talked about the idea of healthcare IT champions, that we do more extensive training with key individuals in each unit, in each floor, in each area, so that they really get more extensive training and understanding of all of the systems that are in their area, so that they can then talk the talk to their friends and their colleagues. That is one way to get out to be pervasive and networked, but it takes a complete and total shift and mindset of what is important in the organization. Our organization talks a lot about safety, so we always tie it back to patient safety, always. And so this is just part of the digital safetiness of your organization, which is just as important as employee safety, patient safety, etc. But with that, how do you do that? Well, you have to have a really good risk management program. We use NIST, the RMF risk management framework, to do this. And there's 6 steps that are key to this. 1, what do you have? How can you tell me that the proper controls are around every single system? And then if you're missing something, how do you identify what you're missing and what we can put in place to protect us? And then how do we continuously monitor and maintain it? It is a program. It is not a project. I always tell people this, just because we just finished our annual HIPAA risk assessment. We just had the readout yesterday. That will spawn us projects for next year to tighten those down. And then we're going to do the whole thing over again. And we're constantly, it's never ending. And this is a requirement of HIPAA. Now, and the other one, recommended periodic assessments, they're going to require annual ones. And like I said, it's a lot of work, but it's a program, and you have to really treat it as a program, and you have to involve all of your stakeholders in it to really understand what is critical for them, what is not, etc. But I use these risk assessments as a mean to continue to build a foundation for my organization to continuously and to always turn the gears. I always tell people, we might add a new little brick to the foundation, but we might have to add a window over here And then how can we make sure that we have the right locks and cameras on that window to make sure no bad actors get in? So we're constantly shifting and changing our tactics depending on what new technology is coming in, what technology is going away, and what the strategies are for the organization. So where should you start? When I'm advising organizations on how to get a handle on their cybersecurity program, this is kind of where I tell them to start. Protect the identities. Know who your users are, why they're there, and what their role is. Only certain people should have access to your medical records. Don't allow the facilities team, for instance. They don't need access. Protect the devices that those people use. Build a fortress around the key systems and around your data. And then lastly, encrypt and protect all your data. Your data is the crown jewels. But what does that mean for going forward? I did a quick Google search when I was creating these slide deck, and these are some of the buzzwords of the stuff coming out. Quantum computing, what is that going to do for healthcare? We don't have enough cybersecurity professionals to even fill all the roles that we have available today. We have a 0% unemployment rate in cybersecurity. And I'm telling you right now, I could hire 50 more people today, and I still wouldn't feel that I'm completely protected. I can't hire them. We aren't producing enough people with those skill sets. The artificial intelligence, all of these words that I know you've heard from various buzzwords, but it's happening. It's a problem. And as all of these come into play, go back to the beginning of this presentation, and they just start adding into the whole conversation again. So again, healthcare is crucial. Cybersecurity in healthcare is crucial to protecting sensitive data. That's our whole goal, is we are protecting the sensitive data that ensures patient safety, complying with regulations, mitigating financial impact, and maintaining trust and reputation, while still supporting innovation and efficiency. But modern healthcare organizations must recognize the risks to the organization and work towards remediation. Not mitigating identified risks is not acceptable by the OCR, and they will fine organizations for noncompliance and ignoring risks. But maintaining a strong cybersecurity measures is crucial for building the trust with your patients and your stakeholders. Your providers must feel that their systems are safe and their integrity of the data is correct, so that when they're recommending a treatment to one of their patients, they have the confidence to know that they are doing the right thing. That is from healthcare IT and from information security, protecting them along the way. And then our patients want to know that when they come to our organizations, their data is going to be taken seriously and their data is going to be protected. And we're going to do everything we can to make sure that it does not get breached. We cannot stay vigilant and enough. And continuous improvement is the only way that we are going to continue in this world. Okay, so we've covered a lot today, and I'm sorry if I talked fast, but so from evolving from the cyber threat landscape and regulatory challenges to securing digital transformation and preparing for the future of healthcare security, one key takeaway from this discussion is really that cybersecurity in healthcare isn't just about compliance. It's about trust, patient safety, and resilience of the entire organization. As technology advances and threats become more sophisticated, it is critical that we continue to prioritize that data privacy, and we continue to prioritize proactive risk management and collaboration across the entire enterprise. It is not just an IT and a cybersecurity project.